Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
It's been just joyful to have two terrific people. One is a physician, and another is the educator to help the physician get his word out. And we're talking with Amore Anti-Aging, and our physician, of course, is Dr. Robert Amore, and then Rick Pepe is the administrator and educator. So thanks for joining us today. We're always happy to learn new things.
Thank you for having us today.
Thank you for having us.
Yeah, and are you learning new things in regenerative medicine at your center when people come in?
I think we are. I think every time we have someone new come into the center, we're always trying different things and different techniques to make things better the next time. So yeah, we continue to learn.
I just came as a moderator from a seminar, and when we had Q&As, and this was on cancer because it's Cancer Month, it was interesting to hear one of the biggest problems about that. We had all these 5 major specialists, but it was the psychology part. They wanted to know, well, I'm just told that I have cancer, or this is going to happen, or what if I don't have a breast? Is my husband going to love me? I mean, it's a lot of things that you would understand. Well, you must have the same thing going on in your center, Dr. Amore.
Yeah, we do. There's a very similar thing when it comes to any type of change that's going to go on with your body. People want to know. They have to deal with it, and as well as their significant other. So those are questions asked all the time. What about this situation? If I have this problem, how, especially with sexual wellness, which we're going to talk about today. I mean, that's a big one. Because they want to satisfy their partner, and so if they feel that they're not up to par to do that in the bedroom, then it creates a big psychological factor.
It's huge, pardon the expression.
Mm-hmm. Huge.
No, it is huge, and most of the time, one of the people in the couple, they don't want to talk about it. Isn't that true? And so you, as a physician, you have to sit there with them, and of course, Rick Pepe has to get it out of them in a sense to say, well, how does it make you feel, or would you be willing to let us work on some things for you?
Yes, and that definitely is a challenge initially. I mean, it could be a challenge whether it be the male side or the female side. It's a challenge because the person has to be comfortable to let go and say these things to you. Now, so that becomes where we, Rick and I come into play, and we sit down and we understand it. And you have to make that person comfortable in order to talk to you. So, I think if you give the information about the things that are going to happen and what's going on, and tell them that 40% of the population has this problem. A lot of people have this problem. It's not unusual, especially as you age. So we're just trying to make your aging a little bit better and less stressful to you.
Well, Rick, talking about this, you think that 2 people are sitting there, and probably one of whom has a hip problem, as well as maybe some sexual problems, and so they just don't want to fool with it. They're in such pain. How are they going to have good sexual relations?
Well, you have to address what's the underlying cause, which is causing that person to have the pain. So obviously, the pain is going to be the first thing to address. So obviously, especially with the hip area, because with the pelvic area, a lot of nerves, unfortunately, they don't conduct the same. So sometimes the hip, believe it or not, if you have any type of nerve damage, can reflect on sexual function as well. Just like lower back pain could do the same thing. So obviously, you want to correct that first. Then from that point, again, you want to educate the person, get them out of their anxiety, because a lot of, especially with women and men, a lot has to do with anxiety as well. They feel uncomfortable about talking about their situation, and a lot of times it can lead up to depression. It can lead to other psychological issues,
divorce,
and that's another one.
It
So
does.
Just to find, get to the underlying cause first. So if they do have that hip problem, obviously that unfortunately would have to be addressed first before the sexual function.
Yes. Seth Levy is watching, and Seth Levy has watched before, and I wish he would contact you because he does something unique. He actually has a mobile van that he goes and he helps with getting people all sorts of health help. And so he ought to really come by your place and maybe could be doing something with it. So we'll see if he does that. But just following up with what you said, let's talk about the whole thing with, and I think if you will explain when someone is under stress or they're not eating properly or there are other reasons why their sexual health, and let's just put it with a gentleman who has erectile dysfunction and why that happens. It's not his fault normally. I mean, it's his fault only because his body's not working. But there are ways that you can help him to understand why, so he's not embarrassed. Isn't there, Dr. Amore?
Yes, there is. I mean, that's like I said before, that's a very prevalent thing today, with men and erection problems, the PE. These are normal things that go on as you get older, and men, they don't like to talk about it, and they definitely feel less than a man a lot of times because they can't perform the way they used to, and that's the big thing that hits them. When they talk to me, they go, "Gee, I remember when I did this. I can't even do that now, or whatever. This happened."
Well, a lot of things.
Yeah.
I mean, they can't run as the same. They can't play tennis the same.
They don't have that ability, the stamina, and so what happens is the blood flow in your body changes. I mean, you start to your veins and arteries start to break down, and so you don't hold blood in the area you need to hold blood for a long term, and so you lose those erections, and they don't sustain. And so this is a big problem for a lot of men. So.
And will you be able to, once you explain this, and they're willing to try some things? We see that Viagra, Cialis, there's all sorts of other kinds of things. Because I think people should be under a doctor's guidance. I don't think they should do this casually. What do you think?
Yeah, I don't think so either. And there are a lot of other things. I mean, the medications alone, the Viagra, Cialis, the Levitras, they've been out there for a while. But again, they can be costly and they can create some problems after you take them. I mean, there's other things that come with those, whether it be heartburn or muscle pain or aches afterwards or headaches, whatever. There's a lot of other problems that men might not want to deal with. I mean, after the 72 hours or the 96 hours they last, you can feel some aches and pains that really are atrocious, actually. So it's not something that a lot of people want to deal with. So what we're trying to do is give them an option that is more natural and will help them maintain and sustain erections longer, and they won't have to take those medications, and it will last a long time, so they can go a year or more without doing that anymore. So that's something that they might want to consider.
So Rick, this is the question that I was thinking as Dr. Amore was saying that. Would stem cells help in that area?
Yeah, we have something called the P shot. And basically the P shot, what it consists of is 3 shots on one side of the shaft and another 3 shots on the other side of the shaft. Obviously, we numb the whole area before we do this process. And basically what it does, it helps to get rid of scar tissue, which will also help the blood reservoirs. The cavernosa helps to hold more blood, which is the blood reservoirs, which keeps the erections a lot harder and a lot longer.
How does it get rid of the scar tissue?
Well, because the stem cell, itself will create new tissue. Will get rid of the scar tissue and create new tissue. Also increases more collagen. And remember, all your arteries, your blood vessels, your capillaries, they all consist of collagen. Your tissue, the skin, same thing. The skin breaks down over time. Same thing with the foreskin. Same thing. Helps to create new skin, new tissue, which will help again with increased better blood flow, keeps the erections a lot harder, a lot longer.
That's great news. You explained that so well, and I'm so glad that we're covering this issue. I'm talking with Dr. Amore and Rick Pepe, and they are. Of course, Dr. Amore is the founder of the Amore Anti-Aging Regenerative Medicine, and I want to give you their phone number and their website. The phone number to call, remember this is Pencil Talk Radio, it's 954-755-0224. And their website is easy, and that's the same thing. It's Amore, A-M-O-R-E, antiaging.com, AMOREANTIAGING.com, Amore antiaging.com. So you'll want to go there. They're located in Coral Springs on North University Avenue. It's very easily accessible. And if you are having any problems, whether it was with your hip or your knee or your back, and you tried all that medication and you've tried shots, why don't you go and give Dr. Amore an opportunity to see if he can help you with stem cells? I just recently referred someone because they were complaining about that, and I said, have you done anything with stem cells? No. What's that? And I said, well, I'm going to just direct you to Amore anti-aging, and they'll explain it to you. And so I was hoping that they got there, but I guess sometimes the pain has to get bad enough, doesn't it?
Sometimes, yes.
Most of the time, yes.
Well,
True.
but what you've seen, of course, is the regeneration. That's
Yes.
why you have regenerative medicine.
Right.
When you thought of that word, you are regenerating tissue that they have, aren't you?
Right. You're giving them back what they haven't had for a while, and you're doing it naturally. And that right there is a plus. Plus, you're taking them not to be able to, they're able to walk right out of their office. They don't have a downtime. They don't have to go through a process of rehab. It's boom, boom, done. You know?
Boom, boom, done,
Yeah,
right?
basically. Boom, boom, done. You know, quicker than anything.
Right.
But that's the thing with regenerative medicine, and again, with erectile dysfunction, you can use PRP as well as stem cells. PRP is one of the recommended. PRP is the platelet-rich plasma.
And how would you do that?
You draw the blood from the individual, you spin it down, and you inject the platelets back into the mixture back into the shaft of the penis and on both sides, and that's how you do that.
And then, will it last?
It will last a long time, yeah, because it continuously, it grows, it creates the new tissue. PRP is very good too, and this is what we use a lot of. So whether it be stem cells or PRP, you can mix them, you do both, but they're both very effective.
And how long will it take? I mean, like, if this happens in your office, does he call his wife and say, I'm coming home,
Yeah.
get ready?
So in the office, that will take, when we do these procedures, whether men or women, it's about 45 minutes. You have to do the numbing procedure first, but the shots are probably 10 minutes long, tops. You're in and out, and then they can walk out. And generally, what we do is we tell them, we say, listen, no sex today, but give yourself another day or two, or sometimes a week. But really, they can go back to regular things right away.
That's fabulous. I'm so glad that you've now started to make this one of the things we're going to be promoting, because I know we've been talking about hips and knees and
Right.
shoulders but I thought about this, and I know Pepe and I were talking about it because I did do a radio show for many years about it, and it was so popular, and I kept thinking, well, maybe you could do this, and Rick jumped on. He said, absolutely, and then you, with your knowledge and specialty, it's a wonderful thing that this is happening. So now you've really expanded your expertise.
It's a great thing, and to have people, to give them an option, other than the norm. I mean, listen, let's go to the female, the O shot. Okay, this is for the female.
Talk about that.
So the O shot is the orgasm shot.
Yes.
So, big thing is vaginal rejuvenation, so that's a surgical procedure, but you could do this with injections now where you don't have to do the surgery. So now you can do 2 shots into the vagina, into the area, and you can go ahead and with those 2 shots, do the same thing. You're going to enlarge, you're going to get the tissue to grow, where it's thinned out.
Will it help incontinence?
Incontinence. It'll help if you've had episiotomy scars, after childbirth. A lot of women after childbirth, they don't feel the same, so that will help tighten up the area. So this is the wonderful thing about the O shot. So, and again, very simple thing. Now, that generally, you could go into the office, and after your 10 minutes injection, you walk out, and if some people feel good right away, and they can have sex that same day, or they might wait a day or two. But it starts to continue to grow. It starts to continue to fix the problem. So it's not like you do a shot and right away it's going to change. But some people feel it right away, some people don't. But the thing is that it keeps working, And that's the cool thing, because now you don't have to go through those expensive or those long surgery rehab type of things. You
Which
can do
may
the
not
shots.
always work, because I remember, and I won't say the hospital, but they were famous for doing certain kinds of, they put mesh inside to help with incontinence, and now they found out that the
causes
mesh was
problems.
coming apart. It was a big problem.
Big lawsuits right now. With
Yeah,
the,
that's
some-
right. So, because a lot of people are facing these very uncomfortable problems, and if they're only 60 or 70, they could be living, according to my book, another 30 years.
Sure.
So we want to do something about it. So you feel very positive, don't you, about helping people with this situation?
Very much so. Yeah, very
And-
much so. This can open up a lot for people.
And Rick, you know, you're the one that tells all the histories and the stories of a lot of the patients, because you're in the education field with this. I have to assume that you're going to start to, without naming names, you're going to start to keep a history of what's going on.
Correct.
So that we can let people know that it's common and that they can have it done, and there's really no downtime or harm. That's the most important.
No harm. It's
No
all
harm.
safe. Yeah.
Yeah, we don't want that. Well, maybe at this point we can move a little bit off of that and go back to the hip and the knee surgery, because you do have a lot of experience, Rick, with that, and you do have really good stories, don't you? Why don't you refresh us? I mean, I don't know if you have 10 stories, but you probably have a lot.
Well, the one that comes out, the biggest one, her name is Martina.
She lets you say her name?
She will now.
Oh, well, we're not giving her a
That's
name.
her last name.
And basically, she is one of our biggest cheerleaders. She's basically in her 60s. She was, Robert walked in there at the place that she worked. He had to get a few supplies, and saw that she was, hopping around. And of course, Rob, the mail guy walked in with a stack of books. And inside one of those books was one of our advertisements. So he went up to her and basically told her, this is what we do. Okay. She looked into it. She spoke to her own physician, which actually he agreed with her to, look into the stem cell. And she was only a couple weeks away from getting a knee replacement.
2 knee replacements.
Not one, but both knees. So she finally made an appointment to come into the office. So she came in. We took pictures of both knees, and she only needed one knee done, not both knees done, just one knee done.
No kidding.
So, and as of today, she's doing phenomenal. She doesn't wear her knee brace anymore. She's in absolutely no more pain. She's doing very well. And
Now-
she's so happy that she did it.
That's a success story. So what
Good
happened,
story.
Dr. Amore, that one of them didn't need it?
Well,
What happened?
so this is the thing. This is what happens. I mean, people, they go into their doctors and whoever, orthopedics or whatever, they want to do surgery. That's what they do, surgery. When I took her pictures, she told me that both knees were getting done in 2 weeks. I said, why don't you come in here first and let me check them out before it's conservative. It's a free consultation. I'll take some x-rays on you, won't charge it. And that's what I did. I said, look, I showed her the 2 knees that I took. I compared the 2. I said, here's the one that's bad. Here's the one that's probably taken a lot of the stress from the one that's bad, and that's why this one's hurting. So let's hold off on that one. Let's fix this one, and and listen, you can try it. It's conservative. If it doesn't work, what'd you lose? Some time and some money, but otherwise, you didn't lose much.
No.
So why don't you try that first? And she did. And Rick said she's excellent. She's feeling great. She's doing things she hasn't done in a long time. Good for her. I'm glad she made that decision.
That's a phenomenal story. When you think about that, I think your chiropractic experience helped with there, because you could really see the knees in a different way than some people see them.
Well, we look at structure and functioning. Orthopedics and other doctors like to they're looking for something. We look for things too, but they're looking for a disease and I look for that too, or anything, tumors, fractures, whatever. We look for all that too. But they don't look so much for how the structure should be. It's just not there. They don't look at that way. So,
Larry Lampert is watching, and Sandra Delsey Lewis is watching. So this is good, because people are really learning a lot from. If you have questions, you can actually ask us on Facebook, and we'll answer it.
Yeah.
But I was very interested in what you just said. I'm just overwhelmed with that. I mean, having had a husband who had both knees done, 4 hips done. If only, this was quite a few years ago, that would have been a wonderful godsend.
Would have been a great thing, Would take
one time, and you can't do this, and and you
would be laid up for a long time with all those things.
What you said is true, Dr. Amore, that one of the hips was the real problem. The other hip, though, started to be affected because you were leaning on that hip, right?
Yeah.
And then the knees, and so it was one bad thing after another. Now, would you do? So if someone came in with knees and hips, would you do the shots and all of them? Not at one time.
No, what I would do is I'd look at all of them. I'd see which one they're saying bothers them the most, and then I'd look at the knees or the hips, and I'd make an assessment, and look at it like, okay, just like I did with Martina. I said, listen, this one might be the bad one. This is the bad one, but this one might be just bad because of this one. So let's do this first, see if things change, and that's what happened with Martina, and she got better. And the same thing will happen to a lot of people. A lot of people, they're not. They listen to the doctor and they say, "Well, you got to get everything done," But you don't always need everything done. You need what you need done, not everything. So that's why.
Well, if Martina, if you're listening or you're out there, they can invite you on the radio show, and we have another microphone for you, because it's nothing like having a testimonial, is there?
Exactly.
And she sounds pretty, and she didn't come there. You found her some other way, and you tempted her, right?
Yeah, well, she's a wonderful lady. She's a very smart lady, and she knew a little bit about stem cells. She was thinking about it, but I think that it just happened to work out that everything fell into that day, because I walked in and the magazine guy came in with this. I just kind of fall, But she, I said, well, if you have that problem, check this out first before you do that, and she did. And so she was, smart about it. It doesn't take too much time to go check something out. We're not asking people to pay money or anything. We're asking them just to check it out.
Okay, so we do have a question. Sandra Daly Lewis said, fell. Been told badly bruised bones. Right hip and spine area hurt a lot. Just having trouble walking. So, what, Dr. Amore, what do you think about that?
All right, so now we have the young lady fell, had a trauma. So there's a bruised area. She was told it was a bruise. But, again, we'd have to look at the x-rays and see what's going on, look at the individual, do some examination on her, see what's moving, what's not moving fully, how the range of motion is. We'd look at those joint areas. We'd look at her body. We'd stand her up, look at how her stance is, and we'd watch her walk. And we look at all these things and see how her structure relates to functioning. And if there's something wrong, then we'll address it, and we'll sit with her and go over it. And that's how we would assess that. Now, you fall, you're going to have a little trauma. That's normal. You break blood vessels, capillaries. You get a bruise. I don't know if she has a bruising there or whatever. And how long has it been? Has it been a week, 2 weeks, a month? These are the things you need to know.
So let's get your pencil out, Sandra, and I'm going to give you the way you can call them. The phone number is 954-755-0224. Again, 954-755-0224. And the website is AmoreAntiaging.com. That's how it really says. AmoreAntiaging.com. And it's Dr. Amore, but we call it Amore Anti-Aging. I got a little confused on that. And he's located, I don't know where you are, but they're located on University in Coral Springs. And I'd love for you to go, and then you could, on our next Facebook, we do this every week, then you can tell us what it was like. I love the idea that people can talk to us this way.
That would be great. We'd love to have her come by, and again,
and it's a free consultation.
It doesn't cost her anything but driving to her office.
Right. And they're both, you can see they're both very cute, Sandra, so you'll enjoy going there. Well, it's funny. People like to see people who are attractive, and you both are attractive, so it's fine. Let me also tell you more about regenerative medicine. That's really your specialty. Stem cells therapy, we've been talking about that. Hormone replacement therapy, we have talked about that also. The platelet-rich plasma, which you call PRP, and that's also certain things, certain places which is the best for that. Facial and hair restoration. We haven't really gone into that, and maybe we will do that also. Time. Right, next time. Joint rejuvenation. We've talked about that. Physical therapy and massage therapy. Now, do people must have a large center, so you can really accommodate all that. Now, Rick, you don't do massage therapy.
No.
Okay, you did, but you manage.
He gets it. Though.
Yeah, he gets it. I was going to say yes, that's right. We all should get it.
Yeah.
But the physical therapy, is that something that you ask people to do? Wait a minute, she just said something. Sandra said, "Very nice, thank you."
Thank
You're
you,
welcome.
Sandra. You're welcome.
Yeah,
Sandra.
that's good. We're gonna start promoting people to talk to us on Facebook. That's what it's all about. So when we talked about physical therapy, though, there might be people who just come in after a hip replacement, right?
Mhm.
And that's what. And John Album is watching now. He's one of our. He sells wonderful insurance.
Blue Cross Blue Shield.
No, don't even say
Okay,
no.
sorry, John.
No. It's
Nice.
United American,
Oh,
and
okay.
I've been with
I know
United
United
American for
American, yeah.
years because if I went to you with United American, boy, they'll pay right away. So John's great,
Okay.
and so he's watching also.
Thank you, John.
This has been a very active morning. I
Yes,
think
it
you're
has.
becoming famous now. People are starting
It's
to
because of
really
you,
see.
Anita. Yeah.
Right. So
Awesome.
anyway, we're gonna let it all pass right now, and next week we're gonna cover some more things, and maybe we'll cover the facial and hair restoration.
All right.
Right.
Great.
That's
Sounds
you have
good.
such gorgeous hair, and you have a gorgeous head.
Well, thank you. I used to have hair at one time.
Okay,
You did,
so
I
thanks
remember.
thanks very much for being with us, and thanks everybody for talking to us, and we'll talk to you next week.
Thank you very much.
Thank you.